Hi, I'm Dr. Gail Randall. I'm here. It's 6 o'clock for my Instagram Live. We're going to talk about inflammation and, why is it such a big deal? Why is it concerned? Something I talk to my patients a lot about, and they can testify to that. But I want you to understand it in better details because, inflammation, you don't want to wish all your inflammation away. It's a protective mechanism. It's how your body protects you from infection. It's how your body, protects you from many, many things. So you do need that response, but it's when it becomes chronic that it becomes a problem. So we're going to talk about that. How do you get it? How do you not get it? And what kind of problems does it cause? Okay? Hi, Francine. Hi, Rena. Nice to see you here. So anyway, let's talk about that. So again, it's a protective immune response, and you've heard this probably in grade school. You have an infection in your finger, it turns red, it gets hot, it gets swollen, and it gets red. So that's inflammation, and that's appropriate. Of course, you want to treat that appropriately with some salve or soaking or whatever, depending on how bad it is. If you really get a bad infection, you're going to need antibiotics. We try to avoid those because they mess up your gut, and that's another way to get inflamed, is to have a messed up gut. So the thing that really gets to me, we live in one of the most, amazing countries in the world, has some of the most amazing food, and we're some of the richest people, and yet about 46% of adults and 56% of children are undernourished. Is that phenomenal? And it's not because they don't have food. It's by choice. They're eating this, what I call the SAD, the standard American diet, which is usually composed of industrialized meat, refined carbohydrates, and maybe sugary drinks and things like that, and that's going to lead to inflammation. There are a lot of ways to get into that box. The chronic inflammation, again, is the problem, not the acute inflammation. You need to maintain your acute inflammatory response. It's protective. So if you have trauma, so you hurt your foot, that can get inflamed. And that's just another thing. And so you want to take care of that the usual way, ice, elevate, whatever, so it doesn't become chronic. Other ways to get into the inflammatory box is the leaky gut. So we're going to talk about leaky gut, poor diet. I've already mentioned stress. Stress chemicals can literally make you inflamed. They kill off your good bacteria, shift your microbiome, and then that's the way you get into that box. Other factors like age, but that's also preventable if you have a great lifestyle and you have a good exercise plan and you eat wonderfully and you meditate or whatever you do to keep your stress down. Age is not as much of an issue. And then there's toxins. So we're all exposed to toxins. I put up on my Instagram, check out the Environmental Working Group. We're like teapots. The longer we live here, the toxins get higher and higher in our body. And, at some point they boil over. So we can't avoid it completely. Well, we can. We can eat organic food, and that decreases our toxic intake. We can not go into toxic places like the ocean, right now, and other things like that. But if I have a great suggestion for you is to eat a lot of green leafy vegetables. Green leafy vegetables detoxify you, particularly cilantro. Now, some people don't like cilantro. They don't have the cilantro gene, and that's okay. Do parsley. I have a green drink that I recommend to my patients. It's part of my Randall's Rainbow Detox. But just do the green drink, get a Vitamix or a Bullet or whatever is your, hi Patty, is your thing. And hi Ellen. And I recommend using cilantro and parsley because they're the most chelating of all the greens. And then just pick your choice. I like to use collard greens. Some people can do spinach. Some people can't, depending on your kidneys and things. And then there's tons of greens out there to choose from. So put all those greens in your Vitamix and then add a carrot or an apple, a little bit of water or a little bit of coconut water. And then my secret is you add a little bit of mint. Now mint is good here for your digestive tract. It's also detoxifying, and then a little tiny bit of jalapeno and you've got yourself a mojito. So, because a lot of people will call a green drink, pond scum or, just try to get it down. Well, this makes it good. Put some ice, it's delicious, and it's detoxing. So every once in a while, clean out those toxins, those glyphosates that come in the food, because we don't always eat 100% organic because we go to restaurants or, it sneaks in there. So, and there's other toxins. So do the green drinks and it'll clean yourself out. So if you get chronic inflammation, a lot of it is gut related. So we've talked about this before, but it's definitely worth talking about again. You have 100 trillion microbes in your gut. 100 trillion microbes. That's more microbes than people that probably ever lived on this planet. So the whole secret is to take care of those bugs. Just like our soil, we got to take care of the bugs in the soil to have good food. We got to take care of the bugs in our guts. Our bugs in our guts are like our mobile soil. We walk around with these bugs in us, and they provide a very important function. It's a sort of a symbiotic relationship, and they do countless functions. And if it gets shifted, and the microbes get shifted in a bad way, it could affect you. It causes inflammation in your body. It also can cause obesity if you get the wrong kind of bugs. If you eat a lot of sugar, you get bugs that actually cause glycemia in your blood and make you more prone to diabetes and obesity. So the bugs have a profound effect. They can lead to health risk for mood disorders, weight, and even Alzheimer's disease. So, and if you eat a lot of fat, you get fat bugs growing in your gut. So you want to take care of those bugs. So we're going to talk about what the best things to eat are. Every bad disease that you do not want to get can come from leaky gut. So we need to take care of our guts. That's where all life sources from. When I went to medical school, this is another thing that's astounding. I wanted to study the bugs. They said, oh, it doesn't matter. They're all commensal. Don't worry about it. It's sort of like out of sight, out of mind. And it was so wrong. Now it's all over, Newsweek and it's, whatever big magazine, the microbiome is everything. Emran Meyer has written books on it. Check it out, The Mind-Gut Connection. And it really is astounding how crucial these bacteria are. And it's the biggest player in a healthy gut bacteria is food. So you want to eat the right food. So the sugary drinks, the high fructose corn syrup, sugar, that is not a good choice for a healthy gut. You're going to shift your microbiome, like I said, towards those diabetic bugs and obesity-causing bugs, and that's going to cause also inflammation in your gut. So when you get inflammation in your gut, just to review this again, we talked about it, your gut cells are supposed to be like this, like a picket fence, just stuck together. See the little lines on my fingers? They have little things called tight junctions that hold them together. And because your body says the things inside your gut are really outside of your body or outside your system. So it wants to decide what it lets in and what it doesn't. So it's the cells that do that. So the cells have brush border, little things like this, and the food gets absorbed by the brush border. It goes through the cells, it gets processed, and then your body decides what gets to go in and what doesn't. So that's the way you want it. But when you get a leaky gut, you've eaten too much sugar, you drank too much alcohol, maybe you got too stressed out or too many toxins. Glyphosates cause leaky gut, and too much gluten can cause leaky gut. There's a guy named Dr. Pisano in 1980. He studied it. He found the more gluten you eat, the more leaky gut you have. Now, there's a little bit of a crossover whether that's actually due to glyphosate or whether it's due to gluten. I think it's both, personally, and I don't feel well when I eat gluten. So, and when I take people off gluten, they do so much better. So I really think gluten has its own toxicity as well as the glyphosates. But anyway, so when the gut gets inflamed, these little cells drift apart. Just like you fall down and skin your knee, it swells, pushes the cells apart, and then what happens? The stuff you put in your gut not only goes through the brush border and it comes in a regulated fashion, but goes right through in between the cells. And when that happens, it goes into your bloodstream and your body, that immune system kicks in and goes, oh my God, there's a dangerous stranger in the house, and it makes an antibody to it. And when it makes an antibody to that food or substance or toxin or whatever it is, oftentimes it will cross-react with things in your own body. Most frequently or most commonly, joints. When people get arthritis, that's from leaky gut. When people get, they often can get, if you let it go on long enough, like 10 years or more, you can get autoimmune disease. So you can get rheumatoid arthritis, systemic lupus erythematosus, Sjogren's syndrome, all of these terrible autoimmune diseases, Hashimoto's thyroiditis. It's all rooted from a gut problem. So let's take care of our guts, and you can get some unwinding of it as well. In other words, you could control it, make it not progress, or, I have people with RA, we fix their guts and they don't get worse, or their levels get better, their RA goes down, their SED rates go down. So it's definitely worth doing whether you've already gotten it or not. So the other thing I wanted to mention was aspartame. Aspartame is actually worse than sugar, and because it favors the growth of fat bugs and increases obesity risk, just like sugar and fat. That's just amazing, isn't it? A little poison. So we want to rebuild and maintain a healthy gut bacteria. So we want to eat foods that are rich in probiotics, like kefir or kimchi or yogurt that's actually real. Now, I don't like dairy, but they have great coconut yogurts now and different kinds, and nut yogurts. But, honestly, I think just get on a good maintenance with a good probiotic. I have one at Randall Wellness. It's called Symbiotic. And I created it based on what we know now about what bugs we need to have in our gut. And it also has prebiotic in it. So that's the other key thing to taking care of your gut, is eat prebiotics. Well, what is it? It's basically fiber. It turns out that our ancestors, our predecessors, ate something like 135 grams of this kind of fiber a day. Well, they ate a lot of root vegetables when they were foraging about. And we probably averagely, the American eats 5 grams. So that's really underdoing it. Things like jicama, Mexican yam, chicory root, dandelion greens, Jerusalem artichoke, onions, garlic, asparagus, healthy grains. But I love blueberries. Blueberries, I've heard say, are the perfect prebiotic. So have some blueberries with your yogurt, and then you've got a big, yummy medicine thing there going on. All right, so the food, back to the food, and back to the poor nutrition, with more than half of our population, adults and children, being undernourished. Unbelievable. And that's what leads to chronic disease. 36.5% of adults are obese, and 32.5% are overweight. So overall, 2/3 of adults are overweight or obese. 2/3 of our population in the United States. That's abysmal. And that's compared to 42% in 2018. So it's on the rise. It's definitely on the rise. And, you know, a lot of it is people not being educated. But then sometimes people are educated. But it's very seductive, these fast food restaurants and our busy schedules. And people just are in a hurry. And so they just stop and get a McDonald's or a Popeyes or whatever. But luckily, I'm seeing that there are more and more healthy restaurants now where you can order food to pick up, you know, having avocado toast or various things like that. So just, you know, make good choices, teach your children, and it's about education. There's 42% of children, 20% of children are obese, and it's on the rise. So there's something I wanted to tell you about that. There's something called epigenetics. And, you know, we always dreamed of the time that we could change our genes. Well, guess what? We've always been able to change our genes. And that's these epigenetic genes which are associated with our mitochondria. And if you're obese, or let's just say obese parents give rise to obese children. And it's through these epigenetic genes that happens. Now, if those obese parents change their lifestyle, it would change their genes. It would literally change their genes, and if they had more children, they would not have the propensity to be as obese as the other children. Now, there's also the environmental patterning. If the parents don't eat right, the children are going to learn not to eat right. But it really is a genetic thing. So if we learn the right lifestyle, if we learn the right diet, the children can benefit. And I just love that. I just love that. I think it's so cool. So, again, inflammation is your body's way of trying to protect you, although sometimes it backfires, like especially in the setting of leaky gut, because when the white cells are attracted, they release cytokines, which attract more white cells and end up in more damage. So we've got to find a way to intervene to cut that off, because the different diseases, and you'll recognize these, are the most common diseases. 75% of our healthcare dollars go to treating these chronic diseases, which basically come from poor nutrition, which basically come from bad food and inflammation. It's crazy. And that's heart disease, number one. That's the number one killer. Cancer, diabetes, arthritis, all kinds of inflammatory diseases, autoimmune diseases I mentioned before, and, pancreatitis, which is a rare one, but anything that has to do with inflammation, can happen. Like I said, all the things that you do not want to have will happen, and including, brain deterioration. And for instance, a heart plaque that explodes is what causes a heart attack. It's inflammatory. Heart disease is inflammatory. You lay down these plaques in your arteries, but what actually causes a heart attack is when they get inflamed and explode. So if you have that big greasy pizza, it causes more white cells. If you have a big slab of meat, which comes with its own cytokines and starts circulating in your body, attracts more white cells, goes to that plaque in your heart, and boom, there it goes. Then you get a heart attack. So this is not what we want to do. Dean Ornish has shown if people will change their diet and change to a plant-based diet, they can reverse the worst kind of heart disease. They can have triple vessel coronary artery disease so bad that they can't even qualify for a heart transplant. He'll treat them for like 3 months. In 3 months, their chest pain goes away. And in another 3 months, their arteries start cleaning up. In a year, they don't even need the heart transplant anymore. So read Dean Ornish's books about reversing heart disease. Read about the plant-based diet. It's miraculous. I've seen heart disease reverse. I've seen cancer reverse. It's, vegetables are medicine. Now, I'm not saying you should never eat meat, but if you're going to eat meat, it should be like a sometimes food, because that's what causes inflammation in your body, is the especially industrially raised meat. And especially meat with nitrates and things like that. It's poison. Okay, so how do we not get it? Okay, so we want to avoid the refined carbohydrates, so sugar, we talked about, but also anything that's been ground down into a powder and pressed out into a cracker or a cookie or a biscuit or even bread. Like, people fight me on this bread thing, and they try to negotiate. Well, what if it's this kind of bread? Well, what if it's whole wheat bread, And of course, whole wheat bread is better than white bread, but and then somebody got the whole thing going that sourdough bread was good for you because it's fermented. Well, fermented is good for you, but white flour is not good for you, because why? We talked about this. It has gluten, and it's ground down into a white powder, and so it's sugar. By the time you chew it, and your amylase mixes with that comes from your saliva, gets down to your small bowel, it's sugar. And that's what we don't want, is sugar, right? That's what throws our microbiome off. Cookies, pasta, bread, all causes gut inflammation, all causes that leaky gut that we really don't want to have by negatively shifting our gut microbiome. We want to have at least 5 servings of complex carbohydrates a day. And what are those complex carbohydrates? Vegetables and fruits. So also healthy grains like quinoa, colored rice. There's a really good kind called Lotus that I like to recommend to my patients. Buckwheat, sorghum, and all the gluten-free whole grains are healthy and have good fiber in it. There's a wonderful bread that I even hesitate to share with you, because I want to be able to get my fix, that I've found that is good, that you can get from Air One Market. Or anybody that makes this kind of bread. It's an artesian, gluten-free bread made from brown rice and sorghum and flaxseed and buckwheat. And it's amazing. When you toast that and you put your avocado on there and make an avocado toast with sprouts, it's really good, and it's so good for you, and you don't feel that full feeling, or, like you're bloated or anything. When you hold it, it's like holding a baby, because it's so heavy, so it's not like your Wonder Bread that, could float or be a cloud or something, but this is really heavy, and it's really excellent for you. So it has plenty of fiber. And it's totally organic, of course, so there's no glyphosates or herbicides or other things that cause inflammation. So we don't want to spare on the vegetables. Like, it always astounds me when people come in and say, I don't really like vegetables, so I don't eat vegetables. And then I tell them, well, you got to figure that out, because vegetables are where the antioxidants are. Vegetables are where the nutrients are. Yellow, orange vegetables is where your beta-carotene is. It's a very strong antioxidant. Purple is where your anthocyanidins are. Very strong antioxidants, anti-cancer molecules. The cruciferous vegetables like broccoli and cauliflower and onions and garlic are where the sulforaphane are. And they are anti-cancer, and they're also treat your gut. They're really good for your gut. They help get rid of H. pylori. They're wonderful vegetables. They help prevent cancer, and they reduce inflammation. So these are things we want to consume. And okay, let's talk about oils. Now, oils, olive oil is good. Olive oil is a monounsaturated fat. And it's monounsaturated fats are the only fats that cannot be turned into inflammatory molecules. So that's a good thing. Vegetable oils, not so good. They oftentimes are refined with hexane, and that's inflammatory. And, you know, so we want to stick with olive oil, coconut oil, avocado oil. Palm oil, although it's good for you, of course, is endangering the Amazon and the orangutan. So we really don't want to use that. There's something else I want to teach you. If you're looking at a food and it's telling you how much omegas are in your food, and it's defining the oil, make sure it all adds up to 100%, because anything that's not 100% is probably a trans fat, and that's the worst kind of inflammatory fat. Now, most of the trans fats have been removed from our fast foods because it's so bad for you that they created a law and it increases inflammatory markers like IL-6, TNF-alpha. It's just the worst kind of thing that causes inflammation, but it's still out there as a preservative in things like biscuits and pizza and stuff like that, which I really don't want you to eat anyway. But read your ingredients and add up your fats, because if anything is left over, doesn't add up to 100%, it's trans fat. And trans fat is real dangerous for your body. What about milk products? Well, milk products contain a lot of casein, which causes inflammation, but the worst part of milk is they allow 750 white cells per milliliter. 750 pus cells in that milk, whether it's organic or not, per milliliter of milk or cheese. So I don't eat it anymore because of that, and I really think it's super inflammatory, because if you're ingesting pus cells, what's in them? The cytokines. The cytokines are going to go in your body. They're going to go in your bloodstream. They're going to attract more white cells, and that inflammatory cascade is going to take place. So not a good choice. Now, there's a great company called Miyoko. That's Miyoko, Miyoko, and they have amazing butter and amazing cheeses. And there are other companies as well. But if you do go for the vegan cheeses, be sure you read them, because some of them are made out of gluten. And that's one of the things we want to avoid, right? So, but these ones are made out of nuts. And there's other companies as well, but I love Miyoko. She makes things out of cashews and coconut and other kinds of nuts, and it's delicious. And you, honestly, I can't even tell with the butter. I almost prefer it to regular butter now. So, refined fructose is a very inflammatory thing. So all of those sugary drinks that we used to drink when we were kids, not so good. They have fructose, and there are literally people that are allergic to fructose now because it's been so prevalent in our society. And fructose gets in your bloodstream and damages your endothelium. The endothelium is the lining of your blood vessels. Now, when that happens in your heart, that roughens it, and that leads to a place where plaque is going to form, or in your brain where plaque is going to form, so that leads to heart disease and stroke. So fructose is not a great choice at all. Now, when it's in a fruit, I always say, eat your fruit, don't drink it. Because it's those little bits, those little fiber bits in the fruit that are what make it a slower carb, are what makes it healthy. And if you squeeze it out and you just are drinking the juice only, you've got a healthy junk food there. So I really highly encourage you to eat your fruit and not drink it. And again, back to meat, especially smoked meats, which can cause, it's called AGEs, which are advanced glycation products, which leads to heart disease, colon cancer, stomach cancer, and diabetes. Any kind of industrial meat has been associated with colon cancer, breast cancer, prostate cancer, and heart disease. So It comes with its own cytokines and also diabetes, and it's by virtue of the inflammatory response that these things happen. So we want to avoid that and eat only organic, pasture-raised, grass-fed, not grass-finished, but grass-fed meats, and not so often. You know, like I said, I've had these anthropologists in my office. They're my patients, and they tell me, Dr. Randall, you're right. Our predecessors only really ate what they foraged, and they very rarely ever ate meat. But I do recommend regeneratively farmed meat because it is anti-inflammatory. The way that they farm these animals, they all graze together on a hectare of land. I've explained this before, but it's worth repeating. And so the cows and the pigs and the ducks and the wild animals are all grazing together, and then they mimic the predator-prey relationship. So along comes the predator, and they move the cows, or all the animals, to a different hectare of land before they eat the grass all the way down. So they only eat the grass about half the way down. Then they move them. They keep moving them until they don't get back to that first hectare of land for about a year. And so it's biomimicry, because when you study how the buffalo roam, how often did they come? They came once a year, and they grazed over here, and the predators came, and then they moved over there, and they never really finished the grass in an area, which made it more robust, made the plains grasses grow even more. And with their excrement and their poop, and they fertilize the grasses. So the regenerative farming restores the grasslands, and it provides a meat that is full of phytonutrients, very strong, from those, robust grasses that they're eating. And one of them is blue nest beef, and it's called blue nest because those guys, because of the way they do it, and they've gotten a lot of other farmers to do it, have brought back the birds of the plains, because the plains bird had disappeared because of the farming practices. So that's a cool thing. Primal Pastures is another one that is local, and Kiss the Ground is another one. So you can Google it. There are more and more all the time, thank God. And these regenerative farms are popping up all over the place. And that's going to be one of the future farming secrets to restoring our land and saving the planet. So cancer is also inflammatory, as I mentioned. And so anything that's going to help prevent cancer is going to also help prevent this chronic systemic inflammation. So I want to share with you some of my protocol, apart from diet and exercise and good food. We talked about some of the food. My first choice, and those that know me as a doctor know that my very first choice, and I love turmeric or curcumin. I'm very pro water-soluble curcumin. I'm not against the root. The root and the regular kind of curcumin stays in your gut and will treat the inflammation in your gut, which is a good thing. But when you have systemic inflammation, if you have systemic inflammation, you want it to get into your bloodstream. And the water-soluble curcumin causes the highest level of free curcuminoids in your bloodstream. So that will treat heart disease, that'll treat arthritis, that'll treat any kind of systemic inflammation. So you want to try to get that kind. The second in line of my favorites is fish oil, but the fish in the ocean are so stressed. You want to try to find a biosustainable fish oil. Randall Wellness has one. And, I question them on that because, when you look into it, the ocean people say there really is no such thing as biosustainable fish oil. But these guys actually have their own boats. So they, for sure, aren't doing that horrible kind of fishing with the big, gigantic nets that are somewhere between 300 feet and 7 miles long, and that are scooping up the whole ocean and killing our ocean creatures faster than they can breed. That this is a real thing, and so the biosustainable fish oil is a real thing if you can, check it out to that degree, which I did. So, we have it, but it's, a lot of people that have put that little stamp on their fish oil is not real. So, but fish oil is super anti-inflammatory. It reduces prostaglandin type 2, which is similar to what taking an Advil might do, but it's natural and it's not going to screw up your stomach like Advil does, or your kidneys. But don't eat krill oil, because that's the food of the whales, and we don't want to take, they're stressed enough, let's not take their food away. So number 1 is turmeric or curcumin, number 2 is fish oil, number 3 is resveratrol. Now resveratrol is also very interesting because it's for longevity. It not only is an antioxidant, it comes from grapes or pine bark, but it's an anti-mutagen that inhibits cyclooxygenate, just like the fish oil does, which is prostaglandin type 2 or COX-X2, but it reduces cancerous growth. But the other thing that it does is it keeps your telomeres, which are these little things on the end of your DNA, long. And those that have long telomeres live longer and are healthier than those that have short telomeres. So people with a good lifestyle, people with a good stress reducing exercises, and people that exercise physically have long telomeres. And resveratrol adds to that. So that's a good way to go. Other things that can help in the anti-inflammatory realm are green tea, because it contains epigalactocatechin, which is EGCG, which blocks tumor necrosis factor alpha, TNF-alpha. That's pretty cool. And I know that COVID came through, and we were recommending a lot of green tea for people because it helps open up the zinc channels as well and repel COVID. So just to regress a minute, back to the obesity thing, I wanted to mention, you probably noticed or heard on the news that the main people that were having to be hospitalized for COVID were overweight or obese. So it just shows what an incredible, depression that is for your immune system. So you want to, when I said those few factors that you had to do, control your weight, don't smoke, don't drink too much alcohol, and have a healthy diet and control your weight, that's not a joke. Being obese or overweight, and I mentioned the figures on that, is a huge health risk factor. So do whatever you can to keep your weight under control. Intermittent fasting is something that I like to recommend to people to get their weight under control. And that's when you do timed eating. You only eat between maybe 11 and 7 or whatever your timed eating is, but helps a lot. Okay, so another thing to help reduce inflammation in your body is chlorella or spirulina. And again, you have to try to find one that is coming from a biosustainable source. Now, I've heard of companies that are growing it in the desert, so away from the toxins of the ocean, and I'm very interested in that. So I'll let you know. I'll give you an update when I find out more about it. But some Korean research indicates that their cancer prevention from chlorella and spirulina. Cruciferous vegetables, I mentioned already, contain that sulforaphane, and that is super anti-cancer. I now use cauliflower as a pizza crust, and that's really cool. And so that you can find it most places. Also arugula, broccoli, cabbage, I forgot to mention before, kale, and turnips. Turnips are one of the richest nutrient-dense foods that there are, and especially the greens. So if you ever want to make a very nutrient-dense stew and detox stew. Put some turnips in there. Can prevent DNA damage and induce cell death and carcinogens. Tomatoes are a great source of carotenoids. In addition to carrots, they have lycopene, and it can reduce TNF-alpha by up to 30%. Mushrooms, I love mushrooms. They contain schizophylline, which is associated with an anti-cancer maitake D fraction, and Coryllius. The thing I prefer the most is a Paul Stamets formula called My Community, and he studied this and he found the more mushrooms that you put together in a formula, especially the ones that he picked with the turkey tail and the maitake, that they, mushrooms are smart and they talk to each other, and they're more effective when you have them as a group than if you have them as a single mushroom, which is really interesting to me. Mushrooms are incredible. If you put a mushroom on either end of a maze, they find each other in like nanoseconds. Explain that. I don't know, but they understand us better than we do. So they network with our nervous system, with our immune system, and they're very beneficial foods and supplements to use. Garlic, with its allicin, is a powerful antioxidant and anti-cancer and anti-inflammatory. And hemp oil helps your body produce melatonin, which is also anti-inflammatory and is a rich source of omegas, omega-3, 6, 9. So that's sort of the formula for if you have bad inflammation. If you don't have bad inflammation but just have moderate inflammation, most people don't leave my office without a curcumin product. So either the water-soluble one or the fat-soluble one from Randall Wellness, because it's better absorbed. Anybody have any questions about inflammation or their own problems they deal with, or what to do about it, or what causes it? I think we pretty much covered a lot of it. A lot of it comes from food. A lot of it comes from leaky gut, the chronic kind. And so we want to take care of our guts and those little bugs that live inside of us. Right? So we want to exercise. We want to eat well. We don't want to eat a lot of sugar. We don't want to drink a lot of alcohol. We don't want to smoke cigarettes, that's for sure. And we want to do occasional detoxification with intense green leafy vegetables, or like a drink, like I explained to you. And be happy. Don't worry, be happy. Do meditation, do breathing. I have a breathing exercise that I teach people. It's really important to control your stress, because those stress chemicals that your body makes are probably the biggest toxins around. So, okay, what is the name of the good bread substitute? It's Air One Artesian gluten-free bread. And you know it because when you hold it, you feel like you're holding a baby. It's so heavy, but it's delicious. And when you eat it, you feel light. It's like the opposite. You'd think, oh my God, I'm going to eat this and feel weighed down, but it's so amazing. I love it. It's made from brown rice, sorghum, flaxseed, and buckwheat. You're welcome. Okay. Hi, Patricia. Okay, I love you guys. If you didn't get a chance to ask me your question, DM me. I love questions, and I love to answer them. So, okay. See you next week. Oh, where do you get it? It's Air One, the bread. I don't know if you can order it online. You might want to check, or get somebody to send it to you from here, Patricia. The only place I've seen it is Air One. Thank you. That's because this person just gave me a compliment and called me beautiful. Thank you so much. But I have another person that watches this. That's one of my patients. She says, "Why do you always look so good?" And you know, honestly, I've never had a facelift or anything like that, but you know, a lot of it is living a good lifestyle and eating really well, you know, because I eat plant-based. I don't smoke. I don't drink excessively. I try to do my detoxes, and I do take a lot of supplements, but it's the ones I told you about. Okay. All right, don't forget to DM me. I'll see you next week at 6 o'clock.